Hi, and welcome to Chapter 4, Injury Emergencies. So first we're going to talk about bleeding control, bandages, and dressings. You use dressings and bandages to control non-life-threatening bleeding. So a dressing directly touches and covers an open wound. A bandage holds a dressing in place. And you use a tourniquet to control massive bleeding or hemorrhaging. Put on disposable latex-free gloves and expose the wound. Cover the wound with a sterile or clean dressing and apply direct pressure until the bleeding stops. If the bleeding is not massive, life-threatening, hemorrhaging, and direct pressure does not stop it within 5 to 10 minutes, add more dressings onto the first one and press harder over a wider area. When bleeding has stopped or you are unable to keep pressure on the wound, then apply a bandage firmly over the dressing to maintain pressure on the wound and hold the dressing in place. If direct pressure fails to immediately stop bleeding from an arm or leg, you can apply a tourniquet. For other body areas where a tourniquet placement is impossible or when a tourniquet is ineffective or not available, insert a hemostatic gauze directly into the wound. And we're going to discuss this more later. After the bleeding stops, you care for the wound. You properly dispose of the gloves and any blood-contaminated clothing. You wash your hands, and if needed, seek professional medical care for cleaning, sutures, or tetanus immunization. For massive life-threatening bleeding, call EMS. Hemostatic dressings. Apply a hemostatic dressing if direct pressure is not effective in controlling the bleeding, a manufactured tourniquet is not available or is ineffective or cannot be applied. Apply hemostatic dressing in combination with direct pressure followed by a pressure bandage. If still bleeding, consider using an improvised tourniquet. So applying a manufactured tourniquet. If direct pressure fails to control bleeding on an arm or a leg, apply a manufactured tourniquet about 2 inches or 5 centimeters above the wound. Do not apply anywhere other than an arm and a leg, and do not apply over a joint. If applying a tourniquet 2 to 3 inches above the wound places it over a joint, you need to place that tourniquet even higher. So tighten the tourniquet by twisting the rod in one direction until bleeding stops. And you secure the twisting rod using Velcro or holder so that the rod does not unwind. Write the time the tourniquet was applied on the tourniquet's tag. If a tag is not available, write TQ or TK for tourniquet and the time it was applied on a piece of tape and you stick it on the person's forehead. Do not cover, release, or remove the tourniquet. If massive hemorrhage continues, the tourniquet is not tight enough and you need to tighten the tourniquet. If still ineffective, apply a second tourniquet near the first, above it if possible, but a second tourniquet is rarely needed. Do not cover, release, or remove the tourniquet. Manufactured tourniquets are preferred over improvised tourniquets that often fail to stop the bleeding. And manufactured tourniquets are designed to be applied with one hand if necessary for self-rescue. Improvise a tourniquet to save a life when direct pressure cannot stop the bleeding and a manufactured tourniquet or hemostatic dressing is not available or is ineffective. So what you want to do is you want to expose the wound. You use a folded triangle bandage, wide roller bandage, or a similar cloth folded into a long band about 2 inches or 5 centimeters wide and several layers thick. But you do not want to use narrow materials like elastic materials or bungee type devices. You want to wrap the folded band twice above the wound, about 2 to 3 inches, 5 to 8 centimeters, and tie an overhand knot. Do not apply this anywhere other than the arm or leg, and you do not apply it over a joint. Place a short, rigid object, for example, a screwdriver or a stick, on top of the knot. Tie a square knot over the rigid object with the ends on the cloth band. Twist the rigid object in one direction until the bleeding stops. And you want to secure the rigid object in place with another cloth band or tape. So you still want to write on a piece of tape TQ or TK for tourniquet, the time applied, and stick it to the person's forehead. If massive hemorrhages continue, the tourniquet is not tight enough and you need to tighten the tourniquet. It's still ineffective. Apply a second tourniquet near the first above it if possible. A second tourniquet is rarely needed. So, a note on tourniquets: the following can warrant placing a tourniquet as quickly as possible. So, that's unsafe conditions. So, that's an active shooter or military combat. If you have an inability to see the wound, it's too dark. And large scale events involving more than one person needing care. So, for example, a natural disaster, an explosion, a car crash, an airplane crash, and you want to place a tourniquet in a high and tight location near the armpit for an arm or near the groin for the leg that allows for fast evacuation and caring for life-threatening injuries. So here are some of the most common tourniquet mistakes. And the most common mistake is not using a tourniquet when you should. But there's also using a tourniquet for minimal bleeding. There's placing the tourniquet on too far from the bleeding site, not making the tourniquet tight enough to effectively stop bleeding, not using a second tourniquet if needed, using anything narrow such as rope, wire, strings, cord, or belt, waiting too long to put the tourniquet on, periodically loosening the tourniquet to allow blood flow to the injured extremity, and then not monitoring the tourniquet's effectiveness. So, a sliver or a splinter, what to do? So, you can remove with tweezers, and you may need to use a sterile needle to tease the sliver into a better position for removal. You want to wash the area with soap and water, apply antibiotic ointment, and then you apply an adhesive bandage. So, what about a large impaled object? So, you do not remove or move the object, and you want to stabilize the object with bulky dressings or padding placed around the base of the object to keep it from moving. And if bleeding, apply direct pressure around the base of the object. Do not apply pressure on the object or on the skin next to the sharp edges of the object. If necessary, you can reduce the length or weight of the object by cutting it or breaking it. And you want to always call 911. So, what to do about amputations? So, you want to call 911. You want to control the bleeding by using direct pressure. And if unsuccessful, you want to apply a tourniquet or hemostatic dressing if available. You want to care for the amputated part. Wrap that severed part in sterile gauze or a clean cloth that has been wet with water or saline. And you want to make sure any excess water has been squeezed out. Put the wrapped part in a waterproof container, like a plastic bag or plastic wrap. Keep the part cool by placing the wrapped part in a container of ice. Do not bury the part in ice or allow it to touch the ice directly. Do not submerge in water. If the amputated part was not found, ask others to search for it, and if located, take it to the medical facility where the injured person is going. So, avulsions, what to do? Gently move the skin back to its normal position, cover with a sterile or clean dressing, and control bleeding. Head injuries. Suspect a spinal cord injury in a person with a head injury. Head injuries can vary in severity from a small cut or bruise to serious brain injury, and that includes any damage to the scalp, skull, or brain. So, what to do for a scalp wound? Control bleeding by pressing on the wound. Replace any skin flap to its original position and apply pressure. And another option is applying an ice pack or instant cold pack to control bleeding. Press on the edges of the wound to help control bleeding. If you suspect a skull fracture, do not apply excessive pressure. This may push pieces of bone into the brain. So, what you want to do is apply a dry, sterile, or clean dressing and keep the head and shoulders raised if no spinal injury is suspected. If bleeding continues, do not remove the first blood soaked dressing. Instead, add another dressing over it. You want to call 911 if the wound is extensive, if there is significant facial damage, or there's signs of concussion. So that's nausea and vomiting, headache, or drowsiness. So, skull fracture, what to look for? Pain, skull deformity, bleeding from an ear or the nose, leakage of clear, watery fluid from the ear or the nose, discoloration around the eyes or behind the ears that appears several hours after the injury, unequal sized pupils of the eye, heavy scalp bleeding, skull and or brain tissue may be exposed, and if you see a penetrating or impaled object. You want to apply a sterile or clean dressing over the wound and hold it in place with gentle pressure. Control bleeding by pressing on the edges of the wound and gently on the center of it to avoid pressing bone pieces into the brain. A donut-shaped pad is useful in applying pressure around the edges of a suspected skull fracture, and then you want to call 911. Caution. Do not move the head, neck, or spine. Do not clean the wound. Do not remove an embedded object. Do not stop blood or clear fluid that is draining from an ear or the nose. And do not press on the fractured area. So, a brain injury or concussion, what to look for? A concussion is considered a mild traumatic brain injury and is caused by a bump, blow, or jolt to the head that can change how the brain normally works. Recognition of a concussion is difficult. Signs of a concussion or mild traumatic brain injury, which may worsen over minutes or hours, include thinking or remembering symptoms, physical symptoms, emotional or mood symptoms, and sleep disturbance symptoms. If unresponsive, check for breathing. If breathing is absent, call 911 and give cardiopulmonary resuscitation or CPR. If a neck injury is suspected or if the person is unresponsive, do not move the head, neck, or spine. Tell the person to remain still as possible and call 911. You want to seek professional care as soon as possible if the person looks very drowsy or cannot be awakened, has one pupil, the black part in the middle of the eye, that is larger than the other, if they have a seizure, if they cannot recognize people or places, if they become more and more confused, restless, and agitated, exhibiting unusual behavior, if they become unresponsive, if they have a headache that gets worse and or does not go away, has repeated vomiting or nausea, or has slurred speech. Following the injury, the person should get plenty of sleep at night and rest during the day. Avoid visual or sensory stimuli. So avoid video games, loud music. You want to ease into those normal activities slowly, not all at once. You want to avoid strenuous physical activities that increase the heart rate or require a lot of concentration. You want to avoid driving, cycling, operating machinery, or playing sports until assessed by a healthcare provider. Avoid anything that could cause another blow to the head or body. And you want to use acetaminophen for post-concussion headaches. You do not want to use aspirin or anti-inflammatory medications. So if you suspect a spinal injury, what to look for? Suspect a spinal injury if a person was in a motor vehicle crash involving injection, a rollover, high speeds, or pedestrians. If they were involved in any other type of motorized vehicle crash, so for example, a motorcycle, a scooter, an all-terrain vehicle, a snowmobile, was involved in a bicycle or skateboard crash. You want to suspect a spinal injury if a person fell greater than their standing height, especially if older, if they dove into shallow water, or if they received a hit or blow to the head. You want to test for sensation and movement in all four extremities. Pinch several fingers or toes while the person has their eyes closed and ask, "Can you feel this? And which finger or toe am I touching?" Ask them if they can wiggle their fingers or toes and have the person squeeze your hand, push and pull a foot against your hand. What to do if you suspect a spinal injury? You want to call 911 and wait for trained rescuers with the proper equipment to move the person. Do not attempt to move the person yourself. Leave the person in the position in which they were found, and you tell that person to remain as still as possible. Consider moving a person only for the following reasons: to provide CPR, to open a blocked airway, to control life-threatening bleeding, or to reach a safe location. Do not apply a cervical neck collar. You can cover with a blanket or coat to prevent heat loss. Thermal burns, what to do? Stop the burning. If clothing is on fire, have the person roll on the ground using the time and true stop, drop, and roll method. Smother the flames with a blanket or douse the person with water. Remove clothing and all jewelry, especially rings, from the burn area. Check and monitor breathing if the person inhaled heated air or was in an explosion. Determine the depth of the burn and help determine what first aid to give. Determine the size of the burn by using the rule of hand. The person's hand, including the palm, closed fingers, and thumb, equals about 1% of their total body surface area. Determine which parts of the body are burned. Burns on the face, hands, feet, and genitals are more severe than burns on other body parts. Seek professional medical care or call 911 for the following: burns on the face, neck, hands, feet, or genitals, breathing difficulty, blistering or broken skin, a large area burn, so such as your back or your trunk, all third and large second degree burns, and for other concerns such as coughing, wheezing, a hoarse voice, or carbon monoxide exposure. So, what to look for first degree burns? That is redness, mild swelling, tenderness, and pain. What to do? Immerse the burned area in cool or cold water, place it under running cold water, or apply a wet, cool, or cold compress for at least 10 minutes as soon as possible. If cold water is unavailable, you can use any other available cold liquid, but you do not want to put ice water, or salt water. And you do want to give ibuprofen. For children and teenagers, you want to give acetaminophen. So have the person drink as much water as possible without becoming nauseated. Keep the burned arm or leg raised and remove any jewelry. After the burn has been cooled, apply aloe gel or an inexpensive skin moisturizer. First degree burns do not need to be covered. If you take a look at figure 4-27, you want to run the burned area underwater to cool the burn. And cooling can take 10 to 45 minutes. And you want to do that until the pain is relieved. Second degree burns, what to look for? blisters, swelling, weeping of fluids, and severe pain. Small second degree burns. You follow steps 1 through 4 for first degree burns with the following additions. After the burn has been cooled, you want to apply a thin layer of antibacterial ointment and you want to cover the burn with loose, dry, non-stick, sterile, or clean dressing. And you do not want to break any blisters. For large second degree burns, you still follow steps 1 through 4 for first degree burns with the following additions. Apply cold, but monitor as it may cause hypothermia. Do not break any blisters, and you call 911. Third degree burns, what to look for? Dry, leathery, gray colored, or charred skin. You want to cover the burn with a dry, non-stick, sterile, or clean dressing. Do not apply cold. Do not apply gel or ointment to the burn, and you call 911. Electrical burns when still in contact with electricity. What to do? Call 911 to have the electricity turned off or the wires cut. Do not touch or move power lines or the person. Do not try to move electrical wires or devices with a wooden pole, rope, or any other item. Excuse me. Keep people away from the area. Electrical burns, what to look for. The burn wound, which might appear small, they may be entrance and exit wounds. Multiple burns. Most electrical burns are third degree burns. And then absence of breathing or a pulse. Electricity can cause a person's breathing or heart to stop. Once the area is safe, check breathing of any motionless or unresponsive person, and if absent, begin CPR. Call 911 immediately. Every person who has been electrocuted needs professional medical care. If the person fell, check for broken bones and a spinal injury. Most electrical burns are third degree burns, so cover all burn wounds with sterile dressing and treat as you would a third degree burn. Chemical burns, what to look for. Pain, burning, breathing difficulty, eye pain, or vision changes. And once the area is safe, brush a dry or powder chemical off the skin with a gloved hand or piece of cloth before flushing with water. Flush the burn with large amounts of cool running water for at least 20 minutes or until EMS arrives. Call 911 immediately for all chemical burns. Do not try to neutralize the chemical. For a chemical in the eye, you want to tip the head so the affected eye is below the nose. Wash the eye with warm water, which is tolerated in the eye better than cold water, from the nose out to the side of the face for at least 20 minutes. Shock. Shock happens when body tissues do not get enough oxygen-rich blood. Do not confuse shock with electrical shock or being shocked, as in scared or surprised. Shock is life-threatening. What to look for? Massive external or internal bleeding, a severe infection, multiple severe broken bones, signs of a heart attack, abdominal or chest injury, severe allergic reaction. For a person in shock who is responsive and breathing normally, you keep that person horizontal on their back. If there is no sign of a leg injury and it does not cause pain, then feet can be raised 6 to 12 inches or 15 to 30 centimeters. Do not give anything to eat or drink unless medical help is delayed over 1 hour, in which case sips of water can be given if fluids do not cause nausea and or vomiting. For a person in shock who is unresponsive and breathing, place the person on their side in the recovery position. Do not move them if there is a neck, back, hip, or pelvic injury. Leave in the position found unless it is unsafe. Call 911. Prevent heat loss by putting blankets or coats under and over the person. And that's all we have for Chapter 4, Injury Emergencies.